I'm Jeff Helfrich, State Representative for House District 52. Life's messy, government's messier. When I was on the street, I got to see what worked and what didn't work. And in Salem, I see a lot of things that aren't working. I want to cut through that red tape, get to simpler government, and get to stuff that works for you. Here's our next episode. That's perfect, right? Welcome back. Today, I have Cyrus Javadi from House District 32 out on the coast. It's Tillamook and Astoria, everything on the good side of Oregon out there by the ocean. It's awesome. Cyrus, thanks for coming on the show. I really appreciate it. We have worked together since 2023 when I came back to the legislature, you came into the legislature, and we've served on committees together. In 23, we were on housing, and now we are on housing again after a little hiatus for me for about a year. But what committees are you on right now? So we had kind of a perspective of that.
Well, glad to be here. Yeah. I did get the pleasure to work with you on housing. Today, just pretty much like 2023, healthcare, and then housing. And then this time, in 23, I was on economic development and small business. But this time I get to be on early childhood and human services committee.
Yeah, a lot of stuff that's important for Oregonians. And so when I have my guests on, I will read your bio so I get it squared away because I don't want to miss something. And if I do, please add into that.
Sure.
So today we have Cyrus Javadi. We talked to him in just a second. And he is State Representative for House District 32, covering Clatsop, Tillamook, and parts of Columbia County. Cyrus is a practicing dentist in Tillamook where he lives with his wife. And he's also a licensed pilot who brings a hands-on perspective to his work. As a moderate conservative, he focuses on practical, common sense solutions that support rural communities, economic opportunities, and individual freedoms. From improving infrastructure, tackling housing, and the challenges that face that, Cyrus is fighting for the North Coast with a back-to-basics approach that puts people first. And let's get started, Cyrus.
Wow. Thank you.
Did you like that? That was a good one, wasn't it?
That was good. That was straight off of ChatGPT, so nicely done.
It was off your website. Come on. Hey, so we're going to dive into your committee work and go from that. But I want to first discuss your life in Tillamook and how that diverse role there has shaped your legislative work right now.
Sure. We moved to Tillamook in 2012. I graduated from dental school in 2008. So between 2008 and 12, we did a stint in Astoria. It was my first gig working for Jim Tyak. He has a dental practice there, or did. He's retired since, right on the Columbia River. And that was my first introduction to Oregon. And I thought it was a great way to fall in love with the state. We had 5 kids at that point. And then we moved to Texas for a short bit. With the financial crisis, the meltdown, there weren't as many opportunities. My dream was to own my own practice, and that first, and so my first job wasn't owning a practice. Moved to Texas and did take over a practice down there, and did that for a few years, but found myself wanting to come back to Oregon. So in 2012, moved back and been in Tillamook since then. Took a little practice and grew it from a few hundred patients a year, and now we see over 10,000 patients visits a year, and the family's grown. I've divorced, remarried. We have a blended family, 9 kids.
The Brady Bunch?
Yeah, the Brady Bunch. We don't have an Alice. We need an Alice some days. And we, I decided to run for office in 2022, and still practice as a dentist Monday through Thursdays in between sessions, and then now, like we are with us back in the Capitol, it's just Fridays that I'm in the dental office.
So you're a working legislator,
yeah,
and paying the bills.
Trying.
It's tough. I mean, it's our salary isn't everything. They seem to think we get paid like we get in Congress, and we don't. And with that said, what is one of the things that you've done living in that small community and that those life lessons from Tillamook that stuck with you and guide you through your work as state representative and trying to make sure that voice is heard? What's one of those things that you've seen or been a part of in that small community?
Well, it's a tight knit community, like most small communities. And when I was trying to decide where to practice, I really wanted to live someplace rural. I thought that that tight knit community would be a great place to raise children, and then I'd have opportunities to be involved, whether it was through Habitat for Humanity or coaching the kids' sports, serving on the school board, well, you name it. And so I liked being able to feel like what you did made a difference in the community. And Tillamook and Clatsop County are really similar in that way. There's lots of little communities. Most of them are, with the exception of Astoria, are just a few thousand individuals. And then you have lots of span between those cities that are unincorporated that make up the rest of the community. And each place has a little bit of its own flavor. But one thing that's consistent is the people who live on the coast have been there a long time. Their families have been there a long time. They're mostly farmers. They work in natural resources, like up in the woods. They're fishermen, and more lately, we have a booming tourism economy as well. And so that was my first exposure to a community that was really tied strongly to their roots and to the natural resources. 62% of Tillamook County is natural resources, and people out there are down to earth. They like to solve problems. They don't like to have their hands held, but they do like to feel like they have the resources they need to fix things, and they're fixers. So if their chainsaws break, they fix it. If their milk machines break, they get them fixed. They're always looking for ways to use the what they have and to depend on each other to fix things and to help each other out. The farmer buys coffee from the little coffee stand on the way, into town to get what they need. The loggers are doing the same, and everybody is pretty close. Everybody knows who each other is. You go to the grocery store and you see people, and it's then you talk about what's going on in their lives, and so it's a feeling of community that I wanted to make sure stayed protected and didn't get overlooked by the state, by some of the policies and laws that we end up having to put into effect as real people that really affect our jobs and our employees and our kids and schools, et cetera.
You touched on it, talk about just kind of when you were in Texas and you came back here, the draw that was coming back to Oregon, and the beauty, we've got more public lands than I think anywhere else in the nation, other than maybe Alaska and some places like that. But what was the draw when you saw from Texas to Oregon? What was the kind of differences that you saw with that?
Oh, well, we lived in Houston. Houston's a massive city and lots of traffic. I had a 25-mile commute each day into the office, and it was hour and a half drive. The schools that my kids went to were thousands of kids. I think the high school that the kids would have graduated from had 5,000 students.
Small college.
So yeah, small. They look like colleges too. So it was everything big city that you'd expect. It was hot. It was so hot. It never rained either. It was very conservative. In Houston, but becoming less conservative as it grew in size. But lots of things to do. Always a traffic jam getting somewhere. Versus Oregon. Oregon's very, especially the coast of Oregon, much slower paced, less crime, less traffic, like I said, and more opportunities to be involved. You're not just one out of millions. You're right. You're one out of a community of 30,000, which is it seems like a lot still, but it makes you feel like you're significant.
Yeah,
people depend on you. Huh.
You're busy. You run a practice.
Sometimes
you run a practice. You run a practice. Both you and I are pilots, and that I don't fly as much as I want to, and I think you're kind of in the same boat too, and would like to fly more. Mm-hmm. But you're a state rep, in those roles that you take into governance, and I've talked about making things simpler, simplifying stuff. I call it the back to basics approach. how do we take that approach? How are you able to take that to the communities? You mentioned just a little bit, not being told what to do, but what's some of the stuff you think about when we're talking about housing? We're talking about economic development and that type of approach to get people just get out of their way. What do you see about cutting rules and red tape and things like that?
Well, you've got some real problems on the coast. Like you cannot, when I moved to the coast in 2012, we could not find a place to rent, we couldn't find a place to buy really either. Housing was a bit cheaper in Texas. I think when we left Texas, when I left there you could have a 4-bedroom house for a couple $100,000. We moved to Oregon, you could have a 4-bedroom house for $500,000. And so, and then you couldn't find anything to rent. So people on the coast are really struggling, for example, to find affordable housing, and not just affordable with the little a, that means subsidized, just anything that they can afford to rent. And part of the reason I learned over time was just how difficult it is to find land that's available to build on. And from working on the housing committee that we've made it really hard for cities and counties to greenlight projects, whether it's through the planning process or subdividing land. And so in the dental world, when I'm fixing teeth, I'm also talking to people. And so you
Are they really talking to you? Or
Yeah.
you just kind of,
well, you learn to read mumble really well. But while you're reading that mumble, you hear what's going on in people's lives, and it's all the same. They're frustrated with what the government does. They don't understand why the government makes the rules they do. When you have rules like the corporate activity, or laws like the corporate activity tax, or pay equity, or Measure 110, to them it's a mystery because it impacts directly on their way of life. And so, if I've got a farmer in the dental chair and we're, getting his teeth cleaned, he's telling me about milk prices, or he's worried about farm worker housing. And you have these discussions, and you start to learn a little about a lot of different people and the way things are impacted by the rules and the laws that are made in Salem. And so, I take those experiences, those real problems that you hear about from people, and I'm sitting in committees, I'm thinking, my gosh, this is exactly what the farmer was talking about, or even the lawyer or the teacher, that, they're frustrated with. How do we fix this?
So Tillamook, Clatsop, or Clatskanie, in that area along the coast,
Yeah.
you've got fishing is a large, used to be a large part of
to fish.
Not only at for sports fishing, but commercial fishing. The fleet's not as big as it was because there's a lot of downturn that happened.
Sure.
You've got forestry and you got tourism. You mentioned all those.
Mm-hmm.
And economic opportunities in that district, I think, are challenging because of where you're located and access, and you can have a number of those things. What opportunities do you think, you mentioned it, Amit, but in those committees that you can raise your hand or chime in on a conversation like, hey, this hurts my community and we have to change this, whoever it's there, because, you sit on the economic development committee, or used to, right?
Used to.
And so those are those things I think where we can have that policy influence, even though we don't have the gavel. But what do you think were things that you could see that we have to cut that red tape for those factors or those jobs, those driving forces for jobs in your communities to get better at? And you mentioned corporate activities tax, pay equity. What else are those things that we can kind of cut through and say, we don't need to have this? If we had gavels, right?
Oh, shoot. What are those? If we were in control of what we do, I think first thing, if we were serious, and I shouldn't say that. If we were serious, I think that our colleagues in the building, whichever letter happens to follow their name, D or R, are very serious about fixing housing. It's a matter of how we do it and where the priorities are. And rural lawmakers, we come to the Capitol with our perspective and how we see things like the housing crisis impacting our homes, and then we're having these conversations with, the chair of the housing committee, and they're coming from a different background, and where those priorities bang into each other is where we start to have those tough discussions.
Right.
So if I had a gavel, what I would do is say, you know what, I think we need more housing. How do we get it? Well, let's get rid of all the rules, or at least suspend them for a while, so that we can actually just build houses. I mean, this is not a complicated equation. Let's suspend all the land use rules that we can.
There'd be some people come unglued. 1,000 Friends of Oregon.
That's okay. We need, but that's what I mean. Yeah, it would upset some people, but 1,000 friends. I'm sure I'd be getting a box of postcards, telling me that I just made the worst choice ever. But yes, I think that we have to get serious about cut red tape. Let's, instead of making cities jump through 100 hoops to greenlight a project, let's let them start building right away. If there are vacant lots, for example, in Tillamook and Clatsop County, you have roads that come off of Highway 101, and if you get adventurous and you decide to go follow one of those roads, you'll start to see homes, and each of those homes are on a minimum of a 2-acre lot, sometimes 5 acres, 10 acres, 20. Nobody is farming on most of those roads anymore. There used to be farms out there. There's not farms any longer, so we have a road going to homes. We have power going to those homes. We have water going to those homes. Each of those homes is on a septic. One of the things I would say is just like, let's just subdivide people want to sell their 5-acre lots and cut them down into 2-acre lots, or 2 acres into 1 acre, or 20 acres into 10 2-acre lots, you name it. We could create lots of housing opportunities right away for without having to put a ton of money into infrastructure, right? We don't have to build a new sewer plant if everybody's on septic. We don't have to dig new trenches with new pipes for water because we already have water and power out there. It's a simple low-hanging fruit, but we can't because of land use rules, because we want to keep Oregon a flavor and a feel to Oregon, which I agree we don't want to overdevelop, but I think when we have a housing crisis like we do and people can't afford places to live, we have to be willing to compromise. And so I think stuff like that. I think the other big one that's in the way right now is infrastructure. If I had a gavel, I would also need a really big purse. And because we would need to funnel lots of money to communities to build more sewer treatment facilities so that we could have homes. I think even if we were to roll back all the red tape in Tillamook County, for example, they still need $60 million to build a sewer plant before they can build a single unit of housing. Yeah. So we need money.
So you've touched on kind of my next question a little bit. Now I want to unpack it a little bit more. Infrastructure in your community, the lifeline of that small community's roads and bridges. And you've mentioned some other infrastructures, but those are the big ones. And I'm on joint transportation. And in my neck of the woods, we have the Hood River Bridge that could literally, if a big barge hit it, it might just fall over. Those pilings don't go down to bedrock. And I've seen those challenges, and you've talked about advocating. I've seen you advocate in housing for infrastructure projects in your district. And what was one of the priorities you tried to get passed for infrastructure itself? Because we're going to dive into housing and healthcare here in a little bit. But what one? I remember a couple of those bills that you were on, your help sponsor, or your just the chief sponsor on, that helped infrastructure wise for your district, what you really advocated for.
I can't remember, but that's a good question. I should remember, but you know how many bills we hear. But one that comes to mind that's not directly housing related, but is infrastructure related, is the transient lodging tax, which made a lot of people.
That's an uneasy conversation. For some people.
It is an uneasy conversation. The transient lodging tax, is the tax that tourists pay when they visit and they stay at a hotel or a short-term rental. And that money gets used, 70% of it gets used for additional promotion to bring tourism dollars, tourists and their dollars to all different parts of Oregon. And then we also use 30% of that tax to fund to fund facilities, or actually, to fund infrastructure, but it goes towards the general fund. Counties and cities can use it for whatever they want. Mm-hmm. And so we've been advocating this session, for example, to change that allocation so that cities and counties that are the most impacted by tourism, and by that I mean it takes employees, which means human beings, to provide those services to tourists, whether it's at a hotel as a clerk or in a restaurant. And if you go into Tillamook County or Clatsop County and you talk to business owners like restaurateurs and the likes, one of the things they'll tell you is we don't have any employees, and we don't have any employees because we don't have any housing, and we don't have any housing because we don't have any infrastructure. So how do we get the infrastructure? Well, raise property taxes. Well, nobody's going to raise property taxes. They're locked in with decades-old measures. And so we come back to, all right, well, how do we fix this? We're going to have to start getting some infrastructure built. We need another revenue stream to do that. And so when I looked around the counties and I saw that Tillamook County, Clatsop County, Lincoln County, and others that have so much tourism were collecting so much in transient lodging tax to spend on more promotion, which was great. But the one thing we saw was that these counties and these cities, the infrastructure that supported that tourism was falling apart. And so we thought, well, let's reallocate some of that money, or let's have a discussion about reallocating that money. And maybe we could use some of that money, like Seaside, for example, has $11 million sitting in an account that they've already paid for their promotion. They still have $11 million left over they can't use for things like infrastructure. Well, what if we could? What if we could use some of that money as matching dollars to unlock other millions of dollars, and then start paying for things like sewer plants? Because guess what? When tourists come to the coast, you know what they do?
Flush the toilet.
They eat, and then they go and they flush the toilet after they use the bathroom, and that has to get processed. And so, let's piggyback on some of the economic benefit that's coming by maybe tapping into some of those dollars. And so one of the things I've been pushing for this term is how do we use some of the economic benefit that's coming from our tourist industry to help offset some of the infrastructure? Because one of the things that's really impacted our community is this is a long answer.
No,
but
keep going. We have time.
But one of the things that one of the things that really impacted
producer Jake back there is paid by the hour, so we're good.
Jake's gonna
or Jacob. Sorry.
You are welcome, Jacob. But one of the big changes for the coast in the last couple of years has been the habitat conservation plan, right? Because we've got so many trees, and a big part, not a big part anymore, but a significant part of our community in our economic revenue pie was the dollars that came from harvesting those trees. And with the habitat conservation plan limiting how much we're going to be able to harvest, that's had an impact on our community. So we can't rely on a lot of those dollars to fund our public works, our infrastructure anymore. The bigger part of the next biggest part of our economic picture is tourism. And interestingly, even bigger than that is Social Security. We have so many retirees on the coast who aren't working. A lot of our income that comes to the coast is coming straight from the federal government through Social Security payments. And so we need to be able to support, while we don't have, though our seniors aren't actively participating in the workforce anymore, they still need services. And so we have to look to the services we do have, or the economic drivers we have, like tourism, and say, what more can we do to support our tourism industry, but also just in the same way I was telling someone the other day, we need tourism, but we also have to support that tourism in the same way that you may want to spend money on a brand new kitchen because it looks good and it feels good, but if you're not also updating the plumbing and the electrical to support that new kitchen, what good's your kitchen going to be? And so we need to share those resources between the both. And it's been popular and unpopular in the capital. I think that there's some worry about how far that could go to affecting in a negative way tourism, and how much will it really help with infrastructure. But I think that if we really want, like I said, to solve the problem of we need employees to drive tourism, and those employees need houses, and those houses need infrastructure, then we're going to have to, something has to give.
Chicken and the egg effect,
It's
right?
definitely chicken and the egg.
So you sit in healthcare,
Yeah.
and as a dentist, you mentioned it, you're talking to people a lot, and there are challenges with healthcare in rural Oregon. The coast is rural.
It is.
And with that, access, high costs, what have you been working on to help alleviate some of those just for your district? I know we want to talk all of Oregon because they see that, but we still have to represent our district, right? And so you'd kind of joked like, well, some people don't refer to me as a real doctor, I'm just a dentist. But without dentists, we couldn't eat without eating, we couldn't be healthy. All those things go along that line. So is there something, kind of cutting through that red tape, getting back to the basics and getting healthcare and driving costs down that you think you're working on or you're trying to get across the finish line, or you see this is just something that's real easy we could get to, but I can't get the chair to listen to me?
Well, healthcare is super complicated. This is why
it
it's
is
a naturopath, right?
Yes.
Yeah.
Oh, yeah. I hear about it all the time.
Right.
How complicated healthcare system is.
It is not. And one of the conversations we'll have often in the caucus and in the hallways is, well, if only the government would get out of our healthcare and the free market could take over, because that would somehow simplify the whole thing. And because it's not that way, we have to kind of deal with what we have. We have a government that's very involved in healthcare, in supporting it. And by government, I mean Medicare, sorry. And we have Medicaid. And then the government also likes to and then we have the Affordable Care Act that put a whole bunch of rules on what commercial insurance companies, your Aetnas and your Modas and your Blue Crosses had to cover and have to pay for, and what employers have to offer. And so when you start to look at the healthcare and we start dealing with some of those problems, like this session, one of the problems was, should insurance companies have to cover menopause-related treatments? And should insurance companies be able to deny breast cancer treatment? If there's, depending on which drug the doctor wants to use. We talked early on about Medicaid treatments and Medicaid reimbursement, and what role does the state have in funding that, and should the state be dedicating as many resources to it? And then you've got a program that most people have never heard of, like 340B, which is...
that has been a touchy subject too in the Capitol. You and I are on the different sides of the aisle now. That's fine. But you get two Republicans talking about it. It's like, it's fine. What is it? What are we doing?
Right. And so when I'm thinking about healthcare issues, I'm thinking about what will be the impact on the patient and the doctor or the nurse or the behavioral healthcare worker that's involved in that mix. And so we've got, when we talk about breast cancer therapy, we've got women who are dying of breast cancer, stage 4 cancer, who are driving from Tillamook, for example, 2 hours to get over to maybe the Knight Cancer Institute. And they're incredibly uncomfortable, and they don't want to have to make that drive multiple times a week. But the chemo treatment that they're on may require multiple visits a week that they have to make those trips over. And so when we hear from those women saying, boy, there's a drug out there, my doctor recommended it, I'd only have to go out once a week instead. Well, the insurance companies hear that and they're like, hey, we love to do that, but it's a very expensive drug. If we do that, it's going to raise the cost of healthcare. And so then the tension comes down to, well, do we require insurance companies, put some pressure on them to say, you're going to have to cover this because women who are dying shouldn't have to drive hours every day, multiple days a week, or shouldn't we? Or should we just pass the cost of that care on to the women? Sure, you can have that medication, but you're going to have to pay for it out of pocket. And those are tough conversations to have. And one of the reasons I love healthcare is, I feel like they're all consequential discussions. And we can make a difference, whether it's the closing of independent pharmacies, whether it's making sure your hospital stays open. One of the bills I worked on this session was trying to get our seniors to get better dental care. So you hit 65, and Medicare does not cover dental unless it's an emergency and only if you receive that treatment in the hospital. Ooh. Well, most hospitals, so if you're a little old lady, little old man, you're on Medicare, you don't have a lot of extra funds, you don't have dental insurance because you're 65 now and you're not working and you can't afford maybe your own private plan. Medicare doesn't cover it. You get a toothache, what do? Well, you're swollen. You have two choices. You can go to the hospital. Maybe they'll cover it. Maybe you'll trust your orthopedic surgeon, your cardiac surgeon to take out your tooth. Maybe you won't. Or you go to the dentist. You go to the dentist's office, unless they're willing to cut you a deal. The average price for getting, for example, a tooth removed is going to be about $500 after you pay for an X-ray and an exam, and then you get that tooth out. or you go to the hospital, and so they choose the hospital. They go to the emergency room. The emergency room doctors say, "Sorry, we can't do anything. Here's some antibiotics." And then the patient's back to where they were. The antibiotics work for a week, and then they ultimately either keep going to the ER or back to the doctor. And I said, wouldn't it be nice if Medicaid helped out these people, our seniors who just need some emergency dental care just to get out of pain so they don't have to use the emergency room, and so that they can feel better. And right now, Medicaid doesn't cover senior benefits either as of today for most seniors unless you're a veteran. And under some tricky rules, you might be able to qualify. So I said, why don't we just make it easy? If you're over 65 and you would otherwise qualify for Medicaid, if you weren't 65, you can still get some limited dental benefits. So that was a big win for our seniors. And we haven't gotten across the finish line yet, but it did make it out of committee. And it's sitting in Ways and Means because it will cost the state some money to provide that benefit. But I think those are some of the things I've been working on, just making sure local rural communities have continued access to as much of the full suite of healthcare as we can give them, whether that's keeping a hospital open through some 340B funding, or whether it's making sure that they're covering things like breast cancer medication or menopause treatment for women, so that people can stay in their communities, and communities can afford to hire these doctors who can come and live in the community to provide these services because they're actually covered.
And that's why I'm happy you're in healthcare and I'm not, because some of that stuff that you just don't know unless you're in it, right?
Yeah.
You just don't know. So something we both know, we both have districts that are surrounded by mountains. We both have districts that have waterways that will keep from building. And mine is a little different because I live in the National Scenic Area and I'm just guided by different rules outside of what Oregon has. You have the ocean. You get canyons just like we do. And both of our areas make building very challenging. You have been addressing housing issues from 23, till now, still in the committee. And affordability, you've touched on that a little bit in constituents, but I remember a bill, it was in 23.
Yeah.
It was something in the floodplain zone. Why don't you talk about that? Because that was a bill where you actually cut through some red tape, and everybody was up in arms about it until it's like, well, no, this is kind of a basic thing to think about, and let's just do this way.
Yeah, so this is an interesting story. So Seaside, for example, all right, if you're going on vacation, you drive down 26, you get to the coast, you take a right, and you end up in Seaside. A lot of people go there, a lot of hotels. They have a beautiful new high school they just put up on the hill. And they've got some good shopping. People like to go to Seaside, and Seaside's one of these communities that reached out and said, we need more housing because we need people who are willing to work in the restaurants and the hotels, for example. But we can't build housing really anywhere that's affordable for people who are working at jobs that, that pay the rates that restaurants and hotels, et cetera, pay. So we don't know what to do because there is buildable land on the hill. But as you noted, there's lots of rules that come with building on the hill. They have to be seismically stable. You have to spend lots of money to prep hillsides. And that just makes the starting cost of a house on the hill out of reach for most people. Yeah. But then you get down to where the flatland is, and right next to the flatland is the ocean. And if you've been on the coast ever, then it floods. As well as
that last flood you had ruined some roads. You didn't get fixed.
Yeah, the rivers fill up. They hit the ocean. They can't go any further. Of course, the tides come in and it pushes all the water onto the land, and it ruins houses, ruins RV parks, blows out culverts, ruins bridges. And so the community is really hemmed in. And we have rules in Oregon that said you cannot build affordable housing with the big A, the one that gets subsidized by the government, in any area that is either floodable, in danger of being wiped out by a tsunami, or a landslide. Well, that is Seaside. It's either going to flood, there might be a tsunami, and the hill could come sliding down whenever it wants. So where do we build? And the city had identified a few lots that were in the city limits that had been zoned industrial or commercial, and they wanted to convert to residential, which they had the authority to do, but not build affordable housing on if they want. And so one of the laws we got across the finish line last time was Yes, you can. And you can build affordable housing on a lot that's residential in a tsunami zone, in a floodplain, if there's really no other place to build it. And that was spelled out in the law. And one of I thought the interesting things that people from the city pointed out that I thought was charming in a way was, well, you're putting people who are the least advantaged among us in harm's way in these affordable houses in the tsunami zone. And I said, where do you think they're living right now? They are living in the tsunami zone in houses that are not deemed affordable. So they're already in harm's way. We want to put them in safer homes that are affordable. And then why don't we talk about how to create better evacuation routes so that if there is an incident, these residents can get out easier. And so working across the aisle with both Republicans and Democrats, we were able to narrow that bill down to a point where everybody was happy. But again, that kind of, and they're not wrong to point out that tension, which was we want to make sure that we're not just putting people who need affordable housing in the worst part of town. We want to put them in nice neighborhoods. But when you don't have the luxury of, and by nice neighborhoods, I mean, right now there's $1 million homes sitting on the beach in Seaside that are just as susceptible to a tsunami as the affordable housing, a few blocks away. So that was a big win, and that impacted a lot of places up and down the coast. It gave, and not a lot, but a little bit more room for communities who already can't find any place to build a few more options. And again, but we're banging into the infrastructure wall again. They can build a little bit, but they can't build a lot because they don't have the sewer facilities to handle it.
Because that bill caused some consternation in my community a little bit.
Yeah.
Because it was in a floodplain. There was this park that they were the city was going to sell, and everybody wanted to save the park, and they thought I sold them out. I'm like, well, no, this is on the coast, and this is what it's meant for. And once I explained it to them, and I said, let's just make sure my amendment was in there that it deemed the coastal area.
Yeah, I remember that. Yeah.
And that was kind of a thing.
That was a good idea.
Like, all right, let's see. They were worried about all that. I want to switch real quick to economic development. You've been on healthcare, then you're on behavioral health and housing. And out of all those, you've touched on a few things. Is there any one thing that stands out that you were able to cut the red tape a little bit that was easy? Not easy, but you're able to get some stuff done. I mean, that one you had there was a good example, but it took some while to get it done. But
well, one thing, we just cut red tape. This is probably, I thought, the most significant red tape, and it was probably the easiest red tape we had to cut. But then again, now it's come back to bite me. So here's the story. So a year ago, Tillamook had an event where we had a dialysis center close. And dialysis you need when your kidneys have stopped functioning. So they're at less than 25% effectiveness. And because of that, your kidneys can't filter the blood, which means you're basically circulating toxic sludge all day long because your kidneys aren't filtering it out, and that's bad for you, right? Bad blood, bad health. So dialysis cleans it up. Well, the dialysis center closed. Now we had about 11 to 14, I forget the exact number of patients who were getting dialysis treatment 3 times a week. That's pretty much the standard. And with that dialysis center closed, they now had to travel over an hour and a half to find treatment. And they started to do that. It was $400 a round trip for some of them to make that and deal with all the coordination of rides and stuff. And they were doing it over roads that, if you've been over Highway 6 lately, is sliding off the mountain into the river. Sometimes the road's icy and snowy all winter, but they still have to go, rain or shine. And these are elderly people that are doing this.
They have to go if they want to live.
Right? If they want to live, they have to go. And so in August, to speed this story up, by some miracle, the hospital found an operator, meaning somebody who knew how to provide dialysis, who would come in into that same facility, the same 4 walls with all the same equipment, and would basically turn the machines back on and hook people up and get their dialysis treatment going. And they said first thing you have to do is go to the Oregon Health Authority, OHA, and ask them for a license to do that. And they went there, and instead of just giving them the license, Oregon Health Authority said, you know what, we're going to have to take a step back. Let's take a pause here. We need you to do a few things before we'll do this. And since August, they've been working on that process. And remember, this is a facility that was just operating 6 months ago. Nothing had changed. But Oregon Health Authority, because of red tape, by red tape I mean all the rules that Oregon Health Authority imposes on an individual or a company when they want to open a new clinic or a clinic, they had to comply with all those. Make sure there were exit signs, make sure there were sinks, make sure there was enough insulation in the walls. 100 different items, and so delay after delay after delay, as the hospital who had given the property away for $1 a year, the company had already gone to great lengths to hire and bring people in, could not get OHA to approve it because OHA, in their defense, had tangled themselves up. Kind of like a fishing line is what I think of. Like they had tied their fishing line in a huge knot. They could not fish because of it. And they tangled themselves up in it, and they could not, by their own rules, greenlight this project. So we introduced a priority bill in February, almost a year after the closure, because no matter what we tried, Oregon Health Authority just could not greenlight this project. And the simple red tape bill said, no. If you've got a facility that was providing dialysis, but the only thing that's changed is the human being that's turning the lights on and off every day, then you can give that new human being the license to operate as long as he's licensed by, to provide medical care within a 2-year window. You don't have to do all the red tape. You can do a quick check to make sure there's not like spikes or, explosives stored in the closet or whatever you want to do. But as long as it's a safe facility otherwise, let them go back in, because these patients absolutely need this healthcare. And if it's the dialysis center this time, what if it's an emergency room in, Coos Bay next time? Or what if over in Klamath Falls, it's a birthing center or something?
Right.
They're going to drive hours to get healthcare because of red tape. So we got the bill through the House. It's on its way to the Senate. I'm hopeful it'll get passed there. But kind of the twist on the story is just yesterday I had OHA in my office saying, hey, that bill that you're working on, well, after it passes, we'll need 9 months to go through the rulemaking process in order to be able to issue that license. And that just points out, like, I cut one piece of red tape, but we're creating another piece of red tape. And so I found out today that the Tillamook Dialysis Center is going to reopen. They just got their license, so they'll be able to start providing care this week, which is amazing. A year later, and lots of emails and meetings later, but we'll have that. But I don't want the next facility to have to go through this. And so this bill will be, once we get through the next 9 months and the rules are made, we shouldn't have another issue like this. But this was one of those red tape cutting ones that feels good, that made it so that we can.
It sounds like you need Representative Mannix to be Amanda Mannix and put an amendment down on that to say you can suspend the rulemaking for that. I mean, there's ways around that. It's just this bureaucracy, and it's like in housing. You had organizations here. If you need to have these fixed. Okay, we fixed those. Moving on to the next chapter. No, we got to go back to this one. Talk about this. It's just this constant back and forth, and people are scared of their own shadows sometimes to make a decision.
Yep.
We're getting ready to close out here, Cyrus. I really appreciate you being here, but you've talked economics, you've talked better infrastructure, healthcare access, housing, cutting red tape through your committee work. What's your overall vision for simplifying how governance works in your district and for the state of Oregon?
Wow, we don't have enough time. That's
give me a couple minutes.
Wow.
I mean, come on, give me a minute or two to answer.
That's good. I mean, I think government should empower people and businesses, right? I've always felt like government's job is to keep the sandbox clean so that whoever comes to play in the sandbox is going to be able to imagine, create, do whatever they want. They're not going to get bullied by somebody else. They're not going to be told they can't do something that's, that they want to put their time, energy, and resources into that's good for them, good for the community. And so I think to the extent that government can get out of the way and empower people to do that, not smother them, I think that's a good one. I think fewer mandates, especially in all aspects of it, but whether it's education or healthcare or housing, let's, to the extent we can, let's stop saying a community has to do something, but then not give them the funding to do it, for example. It gets a little tough. There are some things, like we were talking about healthcare earlier with like breast cancer drugs. Like that's a complicated, messy story. If we don't mandate things, then what happens to certain, to those women who need that healthcare? If we do mandate things, what happens to the cost of healthcare for everybody else? And so I think fewer mandates were possible. And when necessary, maybe we still need more flexibility. I think a tax structure that's business friendly, that invites more of, businesses back to the state. We want their we want their economic benefit, the incomes that come from it, the jobs it creates, the tax revenue that can be used to invest back in the community into roads and sewer plants. And I always say sewer plants, but you can tell it's on my mind. We definitely need to clean our water.
Organics and solids.
I know, right? We need to fix that infrastructure before it fails. I'd love to see, Highway 6 not slide off into the river. I mean, that would be, if Highway 6 goes away, that's a drive from Tillamook or Clatsop County off of one of the other arteries, which is adding, hours to your commute or your travel, which is going to cut into economic activity. And I think just, paying attention to and being very responsive to what, like you started off talking about, what our districts need, having a spine and saying, look, I get that this issue is not necessarily politically popular with my party or my caucus, but in my community, this issue is going to make a huge difference. It may be the difference between a dialysis center or no dialysis center, or housing or no housing, or a hospital that offers OBGYN or doesn't offer OBGYN. And so, and sometimes that means some tough choices, but I think sticking up for what matters to the community, putting them first, people before politics, is how I feel like we stay connected and we rebuild trust with Oregonians, because right now I don't think that they feel like we put them first. I think often we put politics or re-elections or ambition far ahead of, like this water bill we talked about the other day, and I'll end on that. Like we were talking about whether a grandma who waters her flowers can put them in a bucket at the end of her driveway and sell those if she used well water to grow those flowers. Well, she, right now that's illegal. She can't do that if she doesn't have water rights. She can use well water to grow the flowers, but the minute she tries to sell the flowers, she's suddenly
in violation.
She's in violation of the law. Well, grandma might not be making very much money off of it, but maybe that money is helpful for a few things. Or maybe it's a kid who's, doing some 4-H stuff. And I thought, well, that's a common sense fix. And let's, people, when they see things like that kind of basic, fundamental right
Common
to use
sense,
their property
right?
The way they want, their common sense, that's a win for them. And they're like, oh my gosh, I guess that they are listening to us over in Salem. They're looking out for us. And so I think we need more wins like that, and that'll help people restore that confidence in policymakers.
Cyrus, thanks for coming on the show.
So glad to be here.
Appreciate it. People today, we heard from Cyrus. He's got some real practical solutions. He's kind of bucking the system a little bit. And I think I admire him for doing that, because we got to do better and we have to get back to the basics. He established a clear roadmap for his district, and I think there's a lot of lessons learned from that. So tune in next time, but Back to Basics Army, we need your help. We got to get Oregon right-sized, right, and go in the right direction. With that, can't wait to see you till the next episode. Have a good night.